Welcome to this video on essential newborn care and neonatal resuscitation. By the end of this video, you should be able to define essential newborn care, identify critical conditions of newborn maladaptation, select decisions for neonatal resuscitation, and monitor post-resuscitation care. Essential newborn care, or ENC, is a set of comprehensive interventions designed to improve newborn health. The golden minute is the critical first 60 seconds of life where the Help Baby Breathe protocol is initiated. The goal is a smooth transition from intrauterine to extrauterine life. Immediate actions after birth include calling out the time of birth, providing warmth by drying the baby immediately, ensuring a clear airway through positioning, and stimulating the baby to breathe. Preventing heat loss, also known as thermoregulation, is crucial. Conduct delivery in a warm room, dry the baby immediately, remove wet linen, and initiate skin-to-skin contact, also known as kangaroo mother care. For umbilical cord care, clamp or tie it with sterile equipment, keep it clean and dry, and avoid applying traditional substances. For eye prophylaxis, administer 1% tetracycline eye ointment within 1 hour of birth to prevent ophthalmia neonatorum. Vitamin K is administered to prevent vitamin K deficiency bleeding. The dosage for term infants is 1 mg IM, and for preterm infants is 0.5 mg IM, administered in the vastus lateralis or lateral thigh. Early initiation of breastfeeding within the first hour of birth is important. Benefits include providing colostrum, stimulating uterine contractions to reduce maternal bleeding, and supporting thermoregulation through skin contact. Anticipation is a key principle of resuscitation. Risk factors include maternal issues like preeclampsia and prolonged labor, and fetal issues like prematurity. Preparedness requires at least one person skilled in neonatal resuscitation to be present at every birth. The equipment readiness checklist includes items for warmth, such as a radiant warmer, airway, such as a suction bulb, breathing, such as a self-inflating bag, and oxygen, including a source and blender if available. The initial steps of the resuscitation algorithm take 30 seconds. They include providing warmth, positioning the head in a, quote, sniffing position to open the airway, clearing secretions only if necessary, and drying and stimulating the baby. The suctioning protocol guideline is to avoid suctioning healthy, crying babies. The technique is to suction the mouth first, then the nose, as suctioning the nose first may cause the infant to gasp and aspirate secretions. After the initial steps, evaluate the infant based on the big three: respirations, checking for gasping or apnea, heart rate, checking if it is above or below 100 BPM, and color, checking for central cyanosis. Positive pressure ventilation, or PPV, is indicated for apnea, gasping, or a heart rate below 100 BPM. The frequency is 40 to 60 breaths per minute, following the rhythm: breathe, 2, 3, breathe, 2, 3. If the chest is not rising, use Mr. SOPA to ensure effective PPV. This acronym stands for mask adjustment, reposition airway, suction mouth and nose, open mouth, pressure increase, and alternative airway. Chest compressions are indicated if the heart rate remains below 60 BPM despite 30 seconds of effective PPV. The preferred technique is the two-thumb circling method, with a ratio of 3 compressions to 1 breath. Epinephrine is indicated if the heart rate is below 60 BPM after effective ventilation and compressions. Volume expanders like normal saline are used if blood loss is suspected or the infant is in shock. When managing meconium-stained liquor, a non-vigorous infant requires immediate airway clearance at the radiant warmer. A vigorous infant who is crying and active stays with the mother for routine care but requires close monitoring. When monitoring oxygen saturation, place the probe on the right hand for preductal saturation. Target SpO2 levels range from 60% to 65% at 1 minute, up to 85% to 95% by 10 minutes. Post-resuscitation care involves stabilization, maintaining temperature and glucose levels, and continuous monitoring of respiratory effort and heart rate. It is also important to document APGAR scores and interventions performed. Communication with parents should be transparent about the infant's status and compassionate, especially if NICU admission is necessary. Encourage the mother to express breast milk if the infant cannot suckle. Effective resuscitation saves lives and prevents long-term disability. Standardized training is essential for all delivery room staff. Remember that preparation and the golden minute are the foundations of neonatal survival. Thank you for watching this video.